If you look at the Indian healthcare scenario today, there are some excellent examples of patient centricity, excellence in care. And today India ranks, I would say, almost at par or ahead of many of the Western models when it comes to quality healthcare at affordable cost. Yet we also hear, almost on a daily basis that today the Indian healthcare scenario lacks trust, and the way the patients and the general consumers perceive, especially the private healthcare, with a lot of suspicion. So I think first and foremost, what the sector needs to do and what the Indian hospitals need to do is to build trust, which comes through transparency and credibility in their engagement with their patients. The second piece, which again is a corollary to the first one, is how does hospitals today empower patients, whether it is through technology or otherwise, and make them participate in the decision making, in the health decision making, and not treat it as a transaction or an episodial situation. When a patient comes to the hospital, he's discharged, and then it's all done with. It's very important to ensure that the fellowship, survivorship is closely linked and patient remains in the center of the decision making. FICCI is an excellent platform for exchange of ideas, where thought leaders, both from public as well as private sectors, engage and work towards betterment of the industry, and in this case, healthcare sector. If I recall, FICCI has very actively worked on issues of industry, working with the government, whether it was related to taxation, custom duties, penetration of healthcare insurance in this country. And now, when we look at the scenario around price controls or standard treatment guidelines, public-private partnerships. So there are a bunch of areas where FICCI has, and the teams and the task forces which FICCI creates, so that to ensure that there is inclusive approach in working on these subjects. I believe GST is good for the country as well as for the healthcare sector, because it rationalizes and simplifies the environment. Having said that, and given the fact that healthcare services are exempt from GST, but there could be an increase in input costs, because a lot of things that the hospitals buy, whether it's medical equipment or other infrastructure, the impact of GST could be different. For example, on medical equipment, especially capital equipment, because of GST, there is an increase in the custom duty by 2.5 points. So those will lead to increase in input costs for the hospitals. And given that they cannot use this to set off because there is no on the end GST, it may cause some increase. But I think overall, hospitals will have to find ways to be more productive. And I don't foresee that it would increase patient cost or the patient treatment charge. The pricing policy, unfortunately, has added a lot of confusion in this sector. While the intent may be good on part of the government to ensure that the patients are not fleeced and not exploited, because there have been cases around that. But what is very important is for all the stakeholders, again, government as well as the hospital providers, to keep the entire care continuum and the costs around the care continuum in mind. Because it's not just the device cost which is important. One has to look at the entire treatment, at what cost it can be delivered, say a angioplasty, at what price the angioplasty gets delivered in the end to the patient is critical. It's not just the cost of the stent, for instance. And I think there the government should have engaged the private sector and the medical technology companies and the hospital providers in a manner that ultimately the patient would benefit, which unfortunately has not happened, and that's where the confusion is. I believe there is a huge opportunity around public-private participation, and the good news is that the government at the center is supporting it. Niti Aayog has already been tasked to build models, and Niti Aayog very actively has sought inputs from FICCI as an industry forum. They have invited even World Bank, as far as I know, to help them build those models. So we as global companies are in the forefront. We've done a lot of PPPs in UK and other parts of the world. So we are helping the government to create models which can then be adopted by the state governments. so that there is a template available and no one has to reinvent the wheel as far as PPPs are concerned. Because PPPs in healthcare can be very complex, and it's important that in the end we build a model which is win-win and in the interest of the patients at large. When we talk about public-private participation, there could be also private-private participation. And I'll give you a lot of examples, especially in the oncology space, of private-private participation. Given the space in oncology is a little difficult, the incubation is very long. It requires a lot of regulatory approvals from AERB and so on. So you will find some of the oncology chains in India going and setting up onco departments in existing hospitals. For instance, DMC in Ludhiana, is a very good hospital run for several years, doing excellent patient care. But they had no oncology department. So they invited a group called CTSI, Cancer Treatment Services International, who run hospitals in Hyderabad, to come and set up the onco department and also run it. So they have given it. So this is also a private participation. It's not a public-private. So we see these kind of models, especially in oncology, getting stronger. There are companies like CTSI, Healthcare Global, International Oncology, many of them who specialized in oncology. Amrita is a private hospital, a trust hospital. And so these hospitals are also diversifying. And I see it's a good step, because building a hospital is not easy. Traditionally in India, it has been a doctor and his son, and they will set up, or a wife would set up a hospital. But then it would normally be a one hospital phenomena. They would provide good service, but they would not be able to expand because it requires huge amount of capital. So given now the large groups are coming in, whether it is Reliance, whether it is big corporates like Apollo, Fortis, Max, they are expanding. There are a lot of private equity funding which is coming in. CTSI got funded through TPG Capital, for instance. So that gives them the breadth and the muscle to then expand and reach out even in Tier 2 and Tier 3 cities, where there is a dearth of good hospitals.